Laurie Sullivan here from Melbourne, Australia. This is a case of a pupilloplasty. This woman had complicated cataract surgery elsewhere and was left with a dilated and partially angle adherent iris inferiorly in her left eye. And she was getting a lot of glare and requested some help with that. So I thought a pupilloplasty would probably help. So you can see here I'm starting with some viscoelastic in the AC and some intraocular scissors to perform some sphincterotomies to allow a little bit of relaxation of the opposite pupil and also to enable, hopefully, easier apposition for the suturing of the inferior pupil margin. Now I'm just trying to pull the iris away from the inferior angle here, being careful not to tear it and not to avulse it from its root. You can see it's pretty fibrotic, but it is stretching a little bit. And these are in grasping microforceps, retinal forceps. So I've already made some paracenteses here. This is the left eye, so there's a paracentesis at 12, 4 and 8 o'clock. Now I've got the CIF needle with tenoproline on a round-bodied needle, and I have a 27 gauge needle to feed the needle into, but I've actually swapped over to using the Provis cannula, which is also handy for the same thing and has a blunt tip as well, so a bit less traumatic sometimes. So just pull the proline through, go inside and hook it out with a Kugelin hook so I can do the seeps and knots. Getting a little bit caught there in the paracentesis. Grasping the free end of the proline suture and then pulling the knot into the anterior chamber, sliding it along slowly and carefully without pulling on the iris too much. And just bring together that defect. Second throw on that suture. You need to work out which is the free running end of the suture before you tie your knot. Now the second suture. This time I am using the bent 27 gauge needle, I think. The idea of seating it within the needle is so that you don't catch the corneal stroma on the passage through the paracentesis. Just cutting off the needle from that suture. Pleasingly, the pupil's looking pretty round at the moment, and that's with viscoelastic in situ. Just using the intraocular scissors to cut the suture ends pretty short. And removing the viscoelastic. Finally, instilling some myocol to constrict the pupil, and I'm pretty happy with how that's centered. The patient was very happy at 2 weeks post-surgery, telling me that her glare was all gone and her unaided vision was 6 on 9.5. Thanks very much for watching.